This chance goes to the member for, before the Martin Owino, Honorable Martin Owino, there's member for Elgeyo Marakwet. Then Honorable Martin Owino.
Thank you so much, Honorable Speaker, for giving me this opportunity. And one, I want to actually appreciate the Honorable MP, Honorable Sapina Chege, for bringing this motion to this House. Mheshimiwa Speaker, I actually am a subscriber of the public utilities, public hospitals, public schools, because that is where every Kenyan can afford. And that is where the regulations and good policies are, unlike private institutions. And at times, Mr. Speaker, you wonder why government institution or public institution use taxpayers' money to pay very expensive and very exorbitant private hospitals after getting the money from the public coffers. And yet the services offered in the public and the private hospitals are the same. The only difference, or what I can say is, what brings the difference at times, is you find that the public hospital, the management of the public hospital, it's not the doctors, it is not the services, not the drugs, it is the management of public hospitals that is wanting. You find a public hospital, the moment you enter into a public hospital, there is a synonymous smell. There is something that actually notifies you that you are now entering a public hospital. It is not it is not something you can associate with drugs or anything clinical, but it's maybe something of dirt and disposed waste or something like that. So, Mr. Speaker, now that the public hospitals are devolved and they actually with the county governments, I want to urge the governors, because if from where I sit or from the response of the people of Elgeyo Marakwet, SHA is working with us. And the chair for health has just said that it doesn't work with him. Maybe it's because the hospitals in his area or the people, there are no facilities in his area that can actually accommodate the people who want to use SHA in the public hospital. Or the criteria, maybe they were not guided well on the parameters of what people should pay. In that when people feel to be enrolled in SHA, they get a very exorbitant amount of money, maybe 1,000 shillings, and you find them giving up. But if they are guided well, the mama mboga in the village and the local farmer should pay not more than 630 shillings. So most of the people are registered with SHA. Unfortunately, when they go to 6 services at the level 2, at the level 3, level 5 hospitals in the county, they don't get sufficient services because you find there are no drugs, there are no doctors. That is not the failure of the health practitioners. It is the failure of the management of those hospitals. So if the county governments can up their management a little bit, they get stationed person there, the superintendents there to ensure that people report on work, there are drugs. Even the public hospital should have more drugs than even private ones, because the private, they buy. Where these ones, they procure from KEMSA, and KEMSA, we know, they have even the drugs in excess. So I support this one, but as much as I support, also somebody must do their job. That is the county government. They ensure that they are thoroughly cleaned, because that is the hygiene actually that is putting people off. Unfortunately, Mr. Speaker, somebody yesterday forwarded me, and I'll say it's Baringo County. Somebody forwarded me a patient in Baringo Hospital who was in hospital bed. Though the context was not to look at the service that the patient is getting, but he was telling me there is a reported and unknown disease that has been reported. But that person was feeding on a lid of, and it was all over social media. Buckets, the hospital bucket. You see the bucket that people normally carry to go and wash their clothes, and it's green in color. So that person had utilized the bucket to go and fetch beans and ugali there. And it was a green bucket. So you can imagine somebody who is a public servant, or me as Mheshimiwa, Mr. Speaker, or even a primary school teacher, or even a secondary school teacher, or a doctor, like Honorable Nyigal and Honorable Pukose, being admitted in an hospital, then you find them feeding in a plastic, not plate, lid of a bucket. I mean, buying or acquiring even the very cheap plates, the very cheap necessities, the plate, the bucket, the spoons in an hospital, in a public hospital, should not be a tall order. Some of those patients, when they are coming to hospital, they are not anticipating that they are going to be admitted. Some of them are even collected by well-wishers because of the motorbike accidents, and they are just dumped there. They cannot buy them anything to use it there. So I think the governors should just try to make sure that they make it a little bit decent so that the public people can use it. Otherwise, I am an advocate that the public institution should pay money to public institutions to ensure that we are improving the public institutions. That is where we ended up with education in Kenya. It almost got privatized, everything, because people started pouring money into private institutions, and then the private institutions gave extra time to teach. And even the teachers who used to teach in public institutions started paying more money for private teachers who are not even at times trained. They just get somebody who qualified in Form 4, got an A, they go and teach your children, and you pay them a lot of money to teach your children. Here you are a professional teacher, maybe 20 years, 30 years in the service, but you don't even believe yourself that you can teach your child, not even in school, even at home, and pass exams. And we ended up wasting a lot of money, and people ended up becoming very poor because now public institutions were dying. So, Mr. Speaker, I want to support the motion by Honorable Madam Sabina Chege by saying we should actually ensure that the public institutions make it a priority, public servants make it a priority to go to public institution. But the disclaimer that I still give is that the public hospital should also try. And most of those teachers, all the doctors actually in private institutions still practice in public. And at times I wonder, why can they go and call the management of public hospital and even show them how a private hospital looks like and how a public hospital looks